Hi, my name is Wendy Griffith, and I'm a nurse practitioner student at Auburn University. Today, I'll be conducting a complete head-to-toe physical exam on my patient Jordan, who's a 21-year-old adult female. Prior to this examination, I did wash my hands, and we went ahead and checked Jordan's vital signs, which included her blood pressure, respiratory rate, also her temperature, her oxygen saturation. We also checked her height and weight and calculated her BMI. During that time, I also began a general survey of my patient, and I noted at that time her speech, her posture. I also paid attention to her personal hygiene and noted any body or breath odors, and if she was dressed appropriately to the situation and the time of year. So I will be conducting this examination by the techniques of inspection, palpation, percussion, and auscultation, and move systematically from the head to the toe. We'll begin by just assessing the head, and I'm doing an inspection first of all for the pattern of hair distribution, and I'm also making note if the hair's clean, shiny, dull, and then I want to begin to palpate the skull. And I'm feeling during this maneuver if there's any lumps or bumps. And I'm also paying attention to the texture of the patient's hair, noting if it's dry, coarse, and also how evenly it's distributed. I'd also make note at this time if there were any signs of infestations like nits. From that point, I will go on and just inspect the face, and I'm looking generally for symmetry and to see if there's any obvious malformations that I need to pay attention to. And as I move from the head to the toe, I am assessing the skin with each system, and I'm looking at the skin to note if there's any rashes, breaks in the skin, any areas of bruising or vascularity. So I'm looking at that the whole way through the assessment. Ideally, in a clinic situation, my patient would be just in a gown. We'd be in a private situation, and then each part of the body would be unclothed and the examination done directly against the skin. But for the purposes of this video, my patient is going to remain clothed for that. Okay, so we get back to the head, and I have inspected my patient's face, and now I want to do some palpation. So I want to palpate just the frontal and the maxillary sinuses, and I'm palpating for any tenderness or swelling there in the sinuses. And then from that point, I'm going to examine my patient's eyes. And we'll start with a test for cranial nerve number 2, the optic nerve, and we're going to assess visual acuity. Ideally, in the clinic situation, this is done with a standard size Snellen chart from 20 feet away, and we check to see the line of lowest print that the patient's able to read from 20 feet away, and then we also assess their near vision with a Snellen chart smaller and closer up. But for the camera space, we can't quite maintain the 20 feet, so I just wanted to talk about testing a cranial nerve number 2 with the Snellen chart. And then we'll look at the eyes some more, and I want to check the pupils, and I'm using my pen light for that. And we'll look for accommodation first of all, and we want to see, we're looking for how the pupils react to light when there is a bright light shown in them. And we look not only at the pupil that we are shining the light to, but also the opposite one. And we're looking to see if the pupils are equally round and they accommodate to light and constrict to light equally to a normal size of 3 millimeters. And from that point, we will also do a test of, after we have inspected Jordan's eyes, we are looking at the eyebrows, the eyelids, the upper and lower, and I will also just look straight that way for me. Just do some gentle palpation here for any swelling, and I will just pull down and check the conjunctiva to make sure that they look pink and moist and there's no drainage or signs of irritation or infection. After I inspect the external features of the eye, I want to then move in and look at the internal features of the eye. And I use an otoscope to do that. And Jordan, I'm just going to have you look this way. And I will use my otoscope and come in and look towards me a little bit. Okay. And this also, through certain points in this examination, I'm just gonna do one side in the interest of time. But in the real clinic situation, you would do both sides. But as an internal eye exam is done with an otoscope, you are looking at the retina, the internal eye cavity. You are looking for the red reflex that should show up when light is shown into the optic disc. I'm also looking at the vascularity of the retina and the patterns of the blood vessels and how they move into a concentric point to the optic disc. Okay. All right. We do need to do a check at this point. I want to check cranial nerves 3, 4, and 6. And we're going to check Jordan's extraocular eye movements by looking at the cardinal fields of gaze. Okay? And Jordan, what I want you to do is just hold your head still, and I want you to follow this light with just your eyes, okay? Up that way, down this way, up this way, down this way, and then to the side, and to the side. And what I'm looking for during that test is to make sure that there's a smooth movement of the eyes. This is a place where you can pick up on nystagmus if the eyes don't move slowly from one field to the other. Okay. From the eyes, we're going to move on to the ears, and during this test, we're going to be inspecting the external ear features as well as checking cranial nerve number 8, which is the acoustic nerve. So Jordan, I'm going to use this tuning fork and I'm place it at the top of your head, and I want you to tell me if you hear it equally in both of your ears, okay?
Yes.
Okay, good. Now, another test that we're going to do for Jordan's hearing is the Rhine test. That was the Weber. This time, Jordan, I'm going to vibrate this tuning fork and put it on the bone in the back of your ear. And then you tell me when you stop hearing that, and then I'm going to put it in front of your ear. You tell me when you stop hearing that, okay?
Okay. Okay.
Okay. And that test is normal on Jordan. We do expect for air conduction of noise to be longer than bone conduction. Okay. With the ear, if you just turn your head a little bit that way, we want to just inspect the auricle and the pinna of the ear, and also just do a little gentle press on the tragus. I'm looking for any swelling or drainage of the ear. Also, I can note another area of hygiene here, and that looks very good. This is a good time to also check the skin behind the ear. After I inspect the external ear, I want to use my otoscope to do the internal ear, and I will use my otoscope with the speculum on. And for an adult patient, I'll just gently pull the ear up and back and turn your head that way. Gently insert the speculum into the ear, and I look at the canal. First of all, I make note of any cerumen that's in there, the amount, the texture, how much is in there. Also in the internal ear, I'm looking at the tympanic membrane. I'm going to note if there's any fluid that appears in the internal ear, if the tympanic membrane looks pearly and gray. And also, I'm looking for the landmark, the cone of light, and the bony prominence, the malleus in the tympanic membrane. Okay, any pain in your ears?
No.
Okay, all right. So at that point, I'm going to move on to the nose, and we can test cranial nerve number 1 with the nose. So I want you to close your eyes, okay, and just hold. We're going to check each side of your, each nostril, okay? So just compress one nostril for me and tell me what you smell.
Alcohol.
Okay, now do the other.
Alcohol.
Okay, good. All right, then I'm going to palpate the nose, and I'm just going to palpate the bony part first, and then the cartilage part here. I'm looking at that septum to make sure that it looks midline and moist and there's no break or drainage in it. And Jordan, I'll just ask you to tilt your head back, and I'm going to do just a exam on one side with the speculum of the otoscope, and I'm looking into her nose to see the nasal turbinates, to make sure that they look pink and moist, if there's any irritation or signs of nasal discharge in that area. Okay, all right. From the nose, we'll move down to the mouth. The first thing I want to look at with her mouth closed is the vermilion border and her lips, and you can just hold them naturally. And I'm looking to make sure that the skin of the lips looks moist and pink. They're not cracked or dry. And you can do just some gentle palpation around the mouth and feel for any lumps or bumps and look for any breaks in the skin at that point. And then we will look at the oral cavity. I'll ask you just to open your mouth for me. Okay, all right. We're looking at the teeth, the tongue. Now raise your tongue up. Yeah, and we want to look and open your mouth. There you go. Looking at the forehead. Now you can just relax your tongue. Okay, and open. Okay, and I also want to look at the pharynx, the uvula. Okay, say ah for me. And your tonsils look good. You want to look at the tonsil pillars on each side at this point. We can check cranial nerve number 10 when Jordan says ah. You check her gag reflex at that time. Also want to check cranial nerve number 12. You get to have some fun. Stick your tongue out. Okay, now move it side to side. Okay, and that's our check for cranial nerve number 12. Another point I wanted to mention too is when you're examining the head and the face, is to palpate for the temporal mandibular joint here and ask the patient to open and close their mouth. Okay, now clench your teeth. Clench. Okay, and as the patient clenches their teeth, now you can just relax. You can palpate the masseter muscle. That's a good check for cranial nerve number 5, the trigeminal nerve, and the clenching of the teeth. And we want to do cranial nerve number 7, the facial nerve. So Jordan, I'm going to ask you to smile. Okay, now frown. Frown. Okay, now puff out your cheeks. Okay, the cranial nerve number 7 looks intact. Okay, now you can just relax. Okay. I'll put these back over here. Now I'm going to move on to the neck, and the first thing I want to do is just inspect the neck for any obvious lumps or irregularities, any pulsations in the neck too. I want to check for those. After I do an inspection, I'm going to just begin palpation, and I'm going to palpate some of the lymph nodes up here, and we'll start with the submandibular. And ideally, I shouldn't feel these. Okay, and then the submental, the preauricular, the post-auricular, the occipital, and then we have the deep cervical nodes, anterior and posterior. And then coming to the clavicles, we have the supraclavicular nodes. I want to notice at that point if there's any swelling of the lymph nodes, which could indicate maybe an infectious process going on, or if there's a firm, non-movable lymph nodes, we would certainly be alert to any malignancy if that were the case. But I don't feel any of that. Okay. Next, for the palpation of the neck, the first thing I want to do is just to palpate Jordan's trachea here and make sure that it's nice and midline. Okay. And then I'm going to move behind her and do another hearing test. I'm going to whisper something to me, Jordan, then you tell me what I say, okay?
1, 2, 3.
Okay.
2, 5, 6.
Okay, that's right. I also want to palpate Jordan's thyroid gland and examine that at this time. And I'll just find her Adam's apple and then palpate along that. And Jordan, just take a swallow for me. Okay. And the thyroid feels normal. I don't feel any enlargement or lumps on any part of the thyroid. Okay. Now, the next thing we want to do is to go ahead and let's start with the posterior thorax. Okay, so I'll stand behind. I'll stand behind, and again, ideally this would be done against bare skin, but for the purpose of the video, we're going to do it just right over her t-shirt. But I would be inspecting the posterior thorax. I'll look at the skin, and also I would be looking at how her thorax moves with breathing as she breathes in and then exhales out. Okay, and then I also want to check, okay, take a deep breath. Okay, want to check for any CVA tenderness back here, and also we did the test for lung expansion. Okay, the next thing I'm going to do is go ahead and auscultate for breath sounds. So I ask you just to take deep breath in through your nose, out through your mouth. Good. Good, excellent. I'm listening for any adventitious breath sounds at this time. I want to make note if there's any wheezing, any sounds that indicate rhonchi or rales, fluid in the lungs. I want to do now just some palpation and check for fremitus. So Jordan, with my hands here, I want you to say 99.
99.
Okay, again.
99.
Okay. Again.
99.
Okay, good. And there's no fremitus. I'm also checking for crepitus as I do this exam, which could possibly indicate some subcutaneous emphysema, and I don't see any of that. I'll do some percussion back here, and I'm making note of dullness, resonance, hyperresonance, or tympanic sounds. Okay. Now I want to move on to the anterior chest. I'll begin at this point, and we would normally do a breast exam with the patient in this position. We would start, and against the bare skin, we would ask her to put your hand behind your head, okay? And then we would look at the breast for any signs of drainage, dimpling. We would palpate in a clockwise, and you can put it down now. We would palpate the breast in a clockwise position to feel for any lumps or masses all the way around the breast in a clockwise fashion, as well up into the tail of Spence and the axilla. And we would do that bilaterally on each time. This would be a good time also to do some health promotion with this female. We would talk to her about the importance of doing a self breast exam every month, same day every month. And she can learn to examine her own breast for any lumps, bumps, or any changes that may need more attention. Okay. We would also continue the breast exam when the patient is lying down as well. Okay, so you can stay sitting up. Okay, so we're getting back to the cardiovascular system now that we're at the anterior chest. And I'm going to begin and I would be inspecting the anterior chest for any obvious pulsations or movements around the chest. That would be an abnormal finding. You really don't see those. But then you can also palpate around the left side of the chest as well. And then you want to auscultate. And Jordan, you can just breathe normally while I'm doing this. And we'll start over on the right second intercostal space. And listen to the aortic sounds. And then the pulmonic. And then down would be Erb's point. And the tricuspid. And the mitral. And Jordan, I'm going to ask you just to lean forward a little bit for me, and then while she leans forward, I can actually check for the PMI. Okay? This is a good time now with examination of the cardiovascular system to move on, and let's check some peripheral pulses and look at the peripheral vascular system. I want to inspect Jordan's extremities, and I'm looking for the color, feeling for the temperature. This is a good time too when we can look at her nails, not only from an integumentary standpoint, but also from a cardiovascular one. I'm looking at the nails to make sure, I'm looking for the smoothness, the texture of the nails, if there's any ridges, how well attached the nail is to the nail bed. And I also want to do one more check here, and that's a check for capillary refill. As I blanch the fingernail, I'm looking for an ideal capillary refill of less than 3 seconds. Okay, so let's palpate some pulses, okay? We have your temporal pulses up here. And then with the carotid pulses in the neck, we want to be sure and not occlude those. So we'll check those one side at a time. For the rest of the pulses, you would feel those simultaneously, but for the video, so that you can see the best, I'm just going to do one side. So we'll do the brachial pulse here. We'll also palpate the epitrochlear lymph nodes here. We'll do the radial pulse here, and then we'll check the popliteal and the dorsalis pedis and the posterior tibial. Okay, all right, Jordan, I'm gonna have you lie down for me. Okay. As Jordan lies down, I also can check her femoral pulse here, and we can palpate inguinal lymph nodes here as well. Then we want to do some examination of the abdomen here. We're going to listen in 4 quadrants as well as in the epigastric area for the aorta. This particular examination you're going to do in a little bit different order. You're going to do your inspection first. You're looking for any fluid wave, any signs of asymmetry, any lumps, or areas of protrusion, especially checking for hernias. So you want to do your inspection first, and then you palpate, your auscultation next, and we'll auscultate in all 4 quadrants. and I'm listening for bowel sounds. At this point, I would also do an abdominal reflex test. And as the abdomen is stroked, we should see the umbilicus just gently retract. And then we can move on to palpation. We'll palpate each quadrant. Over here, you do some light palpation and then deep palpation. Over in the right upper quadrant, we can palpate deeply for borders of the liver at the mid-clavicular line, coming straight down as you take a deep breath in. And another good point at this point in the exam is a good time for me to let you know I did ask Jordan to empty her bladder before we started the exam. Over in the left upper quadrant, this would be where you would want to check for the spleen. Normally, you would not be able to feel that, but in certain situations, especially if you think a patient may have the Epstein-Barr virus, that's a one where you want to check, especially for enlargement of the spleen. The right lower quadrant is a good place. You want to palpate that for any signs of rebound, tenderness, and palpate the left lower quadrant also. This would be point 2 now that we would move on to the genitourinary assessment. For a female, we would put in the lithotomy position, and I'm going to defer that for the purposes of the video and include that with my additional notes, okay? So I'm going to move on now and just check the musculoskeletal system and also the nervous system. We would check the Babinski sign on the bottom of the foot. Jordan's very ticklish, so I'm talking about that and not actually doing it, okay? And now, Jordan, I'm going to help you just sit up on the side of the bed or side of the cot, okay? All right, and now we want to do some muscular checks with Jordan. Jordan, as I press against your head, you press against my hand. We're testing the strength of your neck here. Very good. And this side. Okay. Now I want you to turn side to side with your neck and then all around. Okay. All right. Arms up and then behind your head. Okay. And then up and out. Okay. We're going to check your reflexes while you're sitting here. Okay, let's look first of all, just let me hold your arm and we're going to check just the elbow reflex and then the wrist, and we're looking for just some gentle movement with that, and we grade those reflexes. And then we also check the reflex of the knee. Okay, just hold it out. And we do reflex of the ankle. Okay, all right, and then Jordan, let's have you stand down. Okay, all right, and then as I hold down on your shoulders, you press up. Okay, very good. And then if you will stand with one leg up, okay, and then your arms out, okay. This is a check of the Romberg test. Now you can just relax, okay, and then arms out and just flap like a penguin for me, okay, and now hands on your thighs, and I want you to do some flappy hands. So palms up, palms down pretty quickly for me. Okay, all right, and now hands on your waist and give me some marching and a squat. Okay, and that completes the one more check for stereogenesis. Throughout this, we've done some checks of the nervous system, the motor system, and also we check sensory. I do want to do one more check, and Jordan, I'm going to ask you to close your eyes. Okay, and I'm going to put a couple of objects in your hand, and you just tell me what they are, okay?
Marble.
Okay, that's right. And tell me what this is.
Cotton ball.
Okay. And tell me what this is.
Paperclip.
Okay. All right. Let's check and make sure Jordan knows, can tell sharp and dull. Okay, so Jordan, this is sharp. Okay, and this is dull. Okay, so I'm going to touch some different places. You tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Very good. You can open your eyes, and that concludes my assessment. It's Wendy Griffith. Thank you.